Hi guys, after a long time, like after many days, I've been shooting a new video, and guys, this is going to be temporarily my last video, like temporarily, because I have a lot of work schedules still pending, and I've realized that somewhere things need to be managed properly, which are right now not happening. So for that, I am taking a break, of course. So let's begin with today's topic, that is tumors of external ear. So tumors of external ear distribution. Ear carcinoma accounts for 85% pinna, 10% ear canal, and 5% for the middle ear. Talking about tumors of pinna or auricle, we have benign tumors, which is first is a preauricular cyst or sinus. Etiology being the development of pinna. During development of pinna, what happens is faulty union of hillocks of first and second branchial arches. So there is a small opening in front of the crux of helix, which presents as an infected cyst, and what happens is the branching tract, when blocked, leads to formation of a retention cyst. So what is the surgery? Surgery treatment is surgical incision to avoid the recurrence, and surgery is indicated when there is an unsightly swelling or infection. Next is a sebaceous cyst. The sebaceous cyst is basically the common site for the post-auricular sulcus below and behind the ear lobule, and treatment is basically total surgical excision. Next is dermoid cyst. Dermoid cyst, as you can see, it's a rounded mass over the upper part of the mastoid behind the pinna, and the important is next one is a keloid. What is keloid? You can see in this diagram, guys. So this is exactly what we mean by keloid. You can see here, and in this diagram it's more properly seen. So basically the keloid will present as a pedunculated tumor, which basically due to genetic susceptibility, black rations, and it follows the trauma and piercing of ear lobules. These are the predisposing factors. Talking about treatment, that's the surgical excision. Surgical excision, basically the treatment with the injection of triamcinolone at the surgical site, and there is also immediate post-operative radiation of 300 rads. Next we talk about is the hemangiomas. Hemangiomas are basically the congenital tumors that often seen in the childhood and other part of the face plus neck, and may also get involved, and there are three types of them. First is basically the capillary hemangioma. Second one is known as the cavernous hemangioma, and the third one is known as a vascular malformations. So what is capillary hemangioma? It is basically a mass of capillary sized blood vessel, and this mass of capillary sized blood vessel will be basically seen as a port wine stain. What is the name? Port wine stain. And this port wine stain, and next is a cavernous hemangioma. This consists of a strawberry tumor consists of endothelial lined spaces, we can say, and also which are filled with the blood, and increases rapidly during the first year but regresses thereafter, may completely disappear by the fifth year. Then we have papilloma or wart. It's a present as a tufted growth, that is a rough grey plaque to feel, and it's a viral in origin. Treatment is curettage with base cauterization and surgical excision. Next is the cutaneous horn. It's basically a horn-shaped tumor due to heaping up of keratin, and location we find is at 2 rim of helix, and in elderly mainly it is seen. Treatment is again surgical excision. Next is keratoacanthoma. Then clinical presentation will be raised nodal with a central crater. Initially it will grow rapidly and slowly it will leave a scar. Treatment being the biopsy, excisional biopsy. This abbreviation stands for biopsy, that is excisional biopsy. Next is neurofibroma. Neurofibroma is basically a non-tender firm swelling associated with von Recklinghausen disease, and treatment is basically the surgical excision. Talking about malignant tumors, in which we have squamous cell carcinoma, basal cell carcinoma, and melanoma. We'll differentiate the three accordingly. The site for squamous cell carcinoma is the helix. For basal cell carcinoma, it's helix plus tragus, and melanoma can occur anywhere in the auricle. Next is most common in male in 50s and sunlight exposure being the predisposing factor. Helix more than 50 years male, and melanoma is basically men of light complexion which is exposed to sun. Present as painless nodular ulcer with raised everted edges plus indurated base, and it presents as basically nodule with central crust, and this crust upon removal shows bleeding. Ulcer with raised or beaded margins may enter deeper into cartilage or bone. Next is basically superficial melanoma. It will present as more than 1 centimeter, post auricular infiltrative melanoma or recurrent melanoma. Then next is metastasis, very late metastasis to renal lymph node. In basal cell carcinoma, very basically lymph node metastasis do not occur. And over here, what happens is that, talking about metastasis of melanoma, 16 to 50% metastasis occurs. Talking about the treatment, so treatment is basically small lesions with no nodal metastasis, 1 centimeter of healthy area around it, large nodules, that is total pinna amputation, then en bloc removal of parotid glands plus cervical lymph node. In treatment of basal cell carcinoma, the not indicated if cartilage, not if there is no involvement of cartilage, then irradiation is the treatment, and if the cartilage is involved, then surgical excision is the treatment. Then talking about the superficial melanoma less than 1 centimeter, then we can go for two things: primary closure and wedge resection. If it's more than 1 centimeter, we can go for infiltrative resection of pinna, parotidectomy, radical dissection. Then talk treatment. So this was about disorders of pinna. Now we will discuss about the disorders of external auditory canal. So here we have benign disorders in which we have osteoma, most common site being the posterior wall of the osseous meatus outer end. From the cancellous bone it arises. It presents a single smooth bony hard pedunculated tumor, and treatment being surgical removal of the fracturing through pedicle removal with a drill. Next is exostosis, most common site being deeper part of the meatus near the tympanic membrane. From the compact bone it arises. Most commonly exposed are basically entry of cold water in meatus, as in divers and swimmers, and also male have 3 times more risk than the female. It will present as a multiple bilateral smooth sessile bony swelling. Treatment being what? First is a small plus asymptomatic, no treatment is needed. If it is large, then basically high speed drill to restore the normal size of the meatus. Ceruminoma being the tumor of the modified sweat gland which secretes cerumins, present as a smooth, firm and skin covered polypoidal swelling in meatal outer wall, obstruct the meatus which causes a retention of wax plus debris. Talking about treatment, its recurrence common, so wide surgical excision, and malignancy, if it is suspected, we must go for post-operative radiotherapy. Then sebaceous adenoma, fourth one, that is smooth skin is covered swelling in the outer meatal wall. Treatment being the surgical excision. Papilloma, fifth one. Then malignant tumors, that is squamous cell carcinoma, long-standing ear discharge case. Primary symptom being the blood staining at the hitherto-purulent or mucopurulent, and discharge plus severe hearing. Examination being the meatal ulcerated area or polypoidal mass or tissue granulation will basically cause a facial nerve and regional lymph node. Treatment being the en bloc wide surgical excision plus post-operative radiation. Then basal cell carcinoma plus adenocarcinoma is there. The treatment diagnosis is done by biopsy. Treatment is done by surgical excision and post-operative radiation. And basically this treatment is next same gone for malignant seminoma. Its features are just twice as common as benign seminoma discussed earlier, and malignant melanoma, which is actually a rare tumor. So yes guys, as you can see, this is the pictorial representation of how a preauricular cyst looks like. So can you see, this is the diagram of basically the post-auricular sebaceous cyst. I hope you can appreciate it. And this is the diagram of preauricular capillary hemangioma. This is the diagram of auricular cutaneous horn. Here you can appreciate the keratoacanthoma. Here you can appreciate a neurofibroma, auricular neurofibroma, that is neurofibroma of the pinna. In this diagram you can appreciate the squamous cell carcinoma of the pinna. This is the diagram of osteoma, which is arising from the anterior wall of the right external auditory canal. You can see that osteoma. Here you can appreciate the exostosis of the external ear canal. Here you can appreciate the ceruminoma, that is ceruminous adenoma of the external auditory canal. That's the squamous papilloma of external auditory canal. You can appreciate over here. You can also appreciate this diagram, squamous papilloma of the external auditory canal. And this is the squamous cell carcinoma of the external auditory canal. That's the basal cell carcinoma of the external auditory canal. You can appreciate over here the adenoid cystic carcinoma, that is adenocarcinoma. These are some MRI and CT scan images. And this is the malignant melanoma of the external auditory canal. As you can see, it has occluded the entire external auditory canal. So yes guys, that was about the tumors of external ear, which has been discussed in great details, and also pictorial representation of the tumors was also depicted in this video. Thank you for your coordination and stay tuned. The next video going to come is on acoustic neuroma and tumors of the middle ear, their clinical aspects, and if possible I'll also include the pictorial representations of the tumors as well. Stay tuned. Thank you.